Hi everyone, it's Amy from Cohuna here. I am doing our 22nd episode of Lunchtimes with Locals, and I just want to show you where I am today. I am at the Northern District Community Health Building in Cohuna. I'll turn around so I can say hi. Hello. Good one. That's nice. So I just sort of thought, I've been to a few of the Main Street businesses in the last couple of weeks, and I was sort of looking for a organisation more than a business this time, just to change it up a little bit. I wanted to go to the CFA, so I'm still going to do that, but they can't really have people there unnecessarily at the moment. So yeah, if you want to stick around and watch the CFA one in the next couple of weeks, I really hope that once COVID's over, we might be able to go there. But for today, I thought it would be nice to talk to the staff at Northern District Community Health at the Cohuna office, because this building, I think, was built about 3 years ago. And yeah, a lot of locals don't actually know what it's for or what they do. And I know because I'm interested and I've used their services before. But if you've never used their services before, it can be a little bit of a mystery about what these actual organisations do in our town and community. And it's a fantastic asset. It's a community service and wonderful staff. But I'll let Mandy and the girls talk a little bit more about that. Hi Ron, I'm outside the office today. Hi everyone. We've got lots of people watching, so thanks for tuning in. So I'm at Northern District Community Health again. Here's the beautiful building, which was designed and built by a local builder. And yeah, on the corner there's the post office. Hopefully Paul and Greta are watching today and their amazing staff. I'm using my gimbal today. I'm not sure if people know what a gimbal is, but it's like a handheld thing that holds my phone and makes it all nice and smooth and steady. It's very heavy and I'm not great at controlling it, so hopefully you won't get seasickness while I'm whizzing you around. But I've been encouraged by our local photographer extraordinaire Shane Mostyn to have a go at it, and something I encourage people to do is to go out of their comfort zone and try different things to improve their businesses. So if it's something that's going to improve these videos and our Cohuna Co business, then I will definitely have a go at it. So hopefully it'll be good. Anyway, let's go inside and meet everyone. I want people to ask questions and get a lot of engagement happening, because you know, these type of health services, they are an absolute asset to our community. And if you're ever unsure about what they actually do here or what services you can access, then please let me know. If you've got any encouragement or shout outs to the staff here for any of the programs that you've attended, please let us know. But let's not dilly-dally and head inside. Obviously, as a health service, they've been affected by the COVID-19, and so we've got some pretty strict rules here. I've already been inside and done my hand sanitizer, etc. And yeah, we'll head inside here. Oh, okay, here we go. Here we go. There's Mandy. Good, thanks, Mandy. How are you?
Very well. Welcome to Northern District Community.
Thank you very much. So Mandy Hutchinson is the CEO of Northern District Community Health, which is obviously Kerrang and Cohuna, and Board. Wow,
and
see? Fantastic. So you've got offices in all those locations as well. See, learnt something already. And we've got Kim over there hiding behind the front desk there. Hi Kim, give us a wave. So you'll be greeted by the amazing admin staff when you come here, and to all the other locations around.
Yeah.
So I might spin it around, Mandy, and we can have a chat, and then we'll do a little bit of a tour, but it'd be good to do a little bit of an intro first.
Yeah,
if I can get the machine
hello.
to oh, there you go. Hi, say hi everyone. Now we're trying to stay apart.
We are, because we're
even
doing our COVID.
We could even put it, let me,
Oh, you like that?
yeah, put it up here. That might be
Yeah.
a good spot. And then we can, you know, do the right thing. Oop,
Yes.
There we go. Now, I told everyone that I'm just learning on my L plates with this.
Yes,
so
very good.
so
Good
yeah,
gadget.
give us a bit of an intro of our Northern District Community Health, and the camera's on that side. If you
Okay,
want.
great. Thank you. Well, we're so thrilled you came with us. to visit with us today, because it is a community health service that we want people to know about, so that they can access our services when they need them. So we see ourselves not as a mystery, although sometimes I know it might feel like that.
Sorry.
But we actually, we're actually a service that was first started here in Cohuna.
Oh, right.
Because the community really saw there was a need for these types of services that we offer. So there's a strong relationship between Northern District Community Health and Cohuna, because it was started here.
Yeah, I didn't know that.
Yeah,
There you go.
So, and we're definitely a community asset. So we try and meet the needs of our community by providing a range of services. In fact, we provide, I counted up before you got here, Amy, and we provide, we've got about 65 staff who are specialists in about 30 different areas, and we deliver about 35 different sorts of services.
Incredible.
Which is just amazing.
Yeah.
And one of the things I know that you think about as a parent, and we all do, is that, you know, this is a great place for young people to aspire to work to, because, you know, there's lots of different roles here at Community Health, and we have lots of locals that we provide employment to, and they're amazing.
Exactly.
So we're really,
Big
really
employer.
lucky. Yeah, we're a big employer.
A lot of people probably didn't
65.
realise that either.
Yeah.
I suppose that's just another thing that everyone can learn about the organisation.
Yeah, that's right. And we've got a board of management. So in fact, locally here in Cohuna, we've got Ronnie Stanton and Cam Hodge and Sandra Fry as our local representatives on our board, and we meet every month, usually about 10 times a year. So yeah, they provide governance and oversight to the organisation. We do get a lot of funding, state and federal funding, but we're also looking to try and do some more fundraising, and so that we can develop a stronger suite of services, so we can really deliver what people need.
Great.
And I thought I'd give you a couple of examples,
Go
Amy,
for it.
of what those sorts
Just
of
making
things
sure it's
are.
loud enough. Give us a thumbs up, everyone, if you can hear Mandy. She's got
you
a
hear me okay?
very engaging voice, so...
One of the things around the drought recently, we worked with some local farmers and did some advocacy with them, particularly around the gaps in mental health. And so we've got a program we devised that Paul Lacey delivers, called the Tactics for Tough Time program. And you might have seen me singing into my hand when we didn't have any GPs. So, you know, we're not afraid to stand up for our community and advocate for when we think there's things that are missing, and that we get the same sort of equitable access to services that anybody gets in Australia. So,
Really good to know. That's something that I've actually noticed, is the response to identified needs.
We don't always get there,
no,
but it never leaves us. Like, it's always one of those things. We've got a bit of a hit list of things that we would love to be able to develop or find funding for, and we never let it go.
No, that's right.
We do try and fill that gap if we can. So,
and if you can't help someone, I'm sure you would then refer them on or find
absolutely.
an answer.
And I was going to mention that lovely segue.
Oh, I know, good.
You know, we do have some really strong partnerships too.
Yep.
So with particularly locally with Cohuna Hospital, but also with the Ganawara Shire Kerang Hospital, Mallee District Aboriginal Services, and VicPol. So even during COVID, and I know you're going to ask me about that, and I'm going to hand you over a bit to Alexia in a minute, but during COVID we've been meeting weekly to try and make sure that we're all saying the same things and trying to facilitate a good conversation about, so that our community knows what to do and what the expectations are. I think we've done pretty well at that. We hope people do know that they can still get services and supports from us and from all those other agencies, but it's just a little bit different at the moment. So we just need to be mindful of that. And I'm really proud of what we've been able to do, particularly with the screening and assessment clinics, and some flu clinics that we've done, but I'm going to let Alexia talk to you about that
no worries, that's
shortly.
Excellent. Well, thank you very much. And you've been on a board meeting at the moment.
I am in the middle of a
board
meeting.
One on a webinar, and that's what all your meetings have been, I guess.
Yes.
Recently.
I think our Zoom meeting, has gone like exponential growth. And our clinicians too have been connecting with people using Zoom and using Health Direct as a way of providing services still. So whilst services changed for a little bit, we had a little bit of a moment where we readdressed things. Most services are still are still working, just differently. And even like our groups, we're still keeping in touch with people who are attending groups and things like that. So it has made a difference and an impact, but I think we've been able to pivot and deliver services still pretty well.
That's right.
So we're pretty proud of that. And our doors have stayed open, but we do have some please stay back.
Every business should have their little guidelines just to help out. And the webinar and the telehealth is something that can probably continue
I think it's great lessons learned.
Exactly.
And in fact, we found that some of our clients actually prefer it. They're in their own home, they feel more comfortable, they don't have to leave. The other thing I want the people out there to know is that all our staff are absolutely schooled in privacy and confidentiality. This is a safe service. This is an inclusive service. This is a service where you can come and you will be welcomed, no matter what your beliefs. We welcome you here. So please, I want the community to know that we take it very seriously, and that there's professional ethics that we abide by.
That's right.
It is a safe place for you to come.
And that's a good thing to address, because that is something that people in a small town particularly worry about. And think that they might not be able to access services, or they might need to go elsewhere to maintain that level of privacy.
And remember, when you come here, you could be coming here for so many different reasons, because we've got 60 different people working here with 30 different services, so no one really knows why you're here. I certainly don't. But I'd love to see you here. I'd say hello, but I certainly don't know why, for example. So I think that's really important to know that it is safe.
Fantastic.
Very
thank
good.
you very much. I'll just check if there's any questions for you. I've got my little scrolling thing there. We've got lots of people watching, 26 people watching live. Hi to everyone. Shannon saying Paul ran his session, the Tactics with Tough Times, at the local fire brigade. Excellent information, and Paul was a very engaging presenter. So isn't that good feedback to have? Is that program running at the moment?
It's running a bit differently at the moment. So Paul's been doing different ways of communicating with people, but he hopes to get it up and running again as soon as we can. But it is running a bit differently, and really there's been so much work to do about how to promote, what people need is safe. He's been absolutely fantastic. He's developed this. I could talk too much. So he's developed this amazing resource for our community with support from our neighbourhood houses as well, about what's available, and so that people in the community can get really good access to what they need at the moment. We've pivoted him a little bit, but the premise of Tactics for Tough Times in the main is 5 ways to wellbeing.
Good segue there,
which is the most beautiful thing ever. Everyone can see that. It's just, this is what guides a lot of our work, Amy. It's so important that people look after themselves, and we do it for ourselves as staff as well. Do you want me to run through what they are?
Well, people can access it on your website and stuff too. I've seen them. I've seen them on the Shire website.
Yeah, we've done it through at the Shire does it with Walk to School. Everyone should have a magnet on their fridge. We've got plenty of brochures here if everybody ever wants it. But actually, it's been proven that if you do these 5 things on a regular basis, you'll be better off from a well-being point of view and a health point of view, but also from an economic point of view. So that's always good to know. That's
always a motivator for most people, isn't it?
Yeah, very good.
That's good. And we organised a Tactics for Tough Times session with Paul for Cohuna Co, but it got cancelled. It was the very first cancellation we had, but we are determined to have Paul at Cohuna Co for a breakfast meeting. So as soon as he gets that program back up and running in person, we will definitely be in touch and organise that. So if people are interested in coming to one, and you're not part of one of the groups like the CFA or the footy club that Paul's been to so far, then anyone is welcome at Cohuna Co to come to one of Paul's Tactics for Tough Times.
We'd love that.
Thanks, Amy.
So
thank you for joining me.
That's okay.
I might talk to Lexi now, because she's
very good.
Thank you very much. Hi everyone. Hi. Do you want Lexi or Alexia? Lexi's fine. This is Lexi Stevens. You can introduce yourself, Lexi, actually, because I like it when people do that.
Oh, okay. I'm the General Manager of Programs and Services.
Excellent.
So that means my role is that I oversee all of the clinical care that happens in the whole of community health.
Yes, and a lot of people will be familiar with your face because you've been in other roles.
I have.
Where have you been before?
I've lived in Cohuna for 30 years now. So I've worked at the hospital for 15 years, and I've been here 15 years as well.
Have you really?
Yes, I have.
did
Worked
not
in Bendigo
know that.
for a bit for, I did midwifery and things like
Yes.
that, so I delivered many people's babies.
I was going to say, a lot of people know you from the delivery ward.
Exactly right. So been here for quite a while and now have worked here as women's health nurse for 11 years and in my current role been for 4.
Wow.
Yeah.
And obviously a very passionate group of people who work here. And
They are. They're amazing. We have a great group of people that work here that work around so many different areas, and some people work very in offices, and other people we don't see they're out and about a lot. Obviously everyone's out and about at the moment.
Yeah.
But they work in so many different areas and different places, and so our main catchment area is the whole of Gannawarra Shire and Northern Loddon. But other than that, we do like programs like NDIS, National Disability Insurance Scheme work. We do that anywhere and everywhere. There are no boundaries for that, and a lot of our work is taking us into Southern Loddon as well. So our staff are very apt at picking up and taking their work with them, because we go to people, they don't necessarily always have to come to us. So this is not unusual, as much as it is unusual because of COVID, but it's not unusual for us not to have a lot of staff in offices, because some people, from a lot of our clientele, we go to them. And we go to the closest town to them. So as much as Mandy's explained, we've got quite a few offices. We actually, a lot of that is around admin and staff meeting with people. But at the moment, it's a lot more to do with telehealth. So that's been amazing for
incredible.
us. Yes.
And what I never realised quite how big it was. I don't know if anyone else out there, I'll have a look at the comments, is saying, Pam said, I've used your services and they're great. It's good. And logistically, for you to manage all of that, that's absolutely incredible. Just having all those staff, and then, as Mandy said, 30 to 40 programs, people travelling all over, and having
a team behind a team.
Absolutely.
And so with that, obviously the face of our organisation is people like Kim and our other community engagement team in Kerrang, and they're always on the end of the phone and picking up emails and making access to care as easy as possible. So we have a medical clinic as well. So we run the medical clinic, Northern District Medical Clinic, which is side by side to the Community Health Service in Kerrang. And so with that, we have this amazing set of staff that are able to respond to people's questions, because sometimes people will often start a conversation with, I don't know if this is the right place to ask, but, and we're up for that, because sometimes it's not, we mightn't have the service, but we know who does.
Exactly.
So it might be something that the Swan Hill or Echuca might have, or the hospital might be doing, or something that they're a connection with the Shire, and we're more than happy for people to ring up and not, even if they don't exactly know what they're looking for, we can talk them through, and the front desk staff do that a lot. But we also have clinical staff that are able to take those phone calls in if the front desk staff aren't so sure themselves, and things that I'll put you through to an occupational therapist, or I'll put you through to one of our counselling staff. So we have 5 different teams. So we have a medical clinic, but we also have what we call community support team, which is like housing and counselling and NDIS team, as well as alcohol and other drug team. Then we have a nursing team, which is run by Jenny Breton, who is also a very well-known local.
She is,
yes,
exactly.
It's lovely working
you guys
with,
are all very engaging.
We
and
are.
uplifting,
We work with people because they're amazing, and
Yes.
it's interesting because people have the right qualifications, but the people that work here have the right qualities, and
Yes,
we know
that's
that
really important.
It is
isn't
absolutely
Yes.
important. We want people to, when people come through the door, we want them to feel really welcome. We want them to be able to talk about their situation in a really private and comfortable way, and be given options around what they might like to what services they might think are useful. So that's really the hinge point for community health, is about options, and the person in charge of their care is absolutely the person the person is an expert in their own lives, and then we just are able to sometimes oil the wheels of those conversations, that knowing where they might ask the question, or how they might do that, or do they need a referral for that, or how do you even start a conversation with a GP around that? All those sorts of things are really important. Youth is a really interesting area for us, because there's not a lot of youth-based assistance in country, in rural environments, so we do our best around that as well. But again, that means working a lot with schools, and we do that. We work with all of our local schools. We've got a program called School Focused Youth Service, which is about working with schools around working with trauma-informed practice, and working with kids that are having just that little bit of difficulty with connecting with schools, which could be something that comes up now with kids having been away.
That'll
for
be
a
on the
little
radar
bit.
for
Exactly
sure.
right. So we try to be really flexible in the work that we do.
Yeah.
So as we know that there's some things that we can't do during the COVID time, and there are other things that we call surge areas, and one of those was a screening and assessment clinic. And what we were able to to do then was repurpose some of our staff that couldn't do one-to-one care, which is our podiatrists and our occupational therapists, and we moved them into they turned into logistical amazing people who ended up, we've done over 700 swabs and over 700 flu injections on majority of those people are different people, so not the same people. So with that, we've had 6.5 days of flu clinics. We always do flu clinics in the clinic, but what we know with COVID is that people had to have social distancing. They needed to have questions around their health before they came in to make sure that they weren't showing any signs of illness. So it was an absolute team effort. So we've finished off our flu clinics, but now what we're doing is screening clinics every single day. So we had a screening clinic here in Cohuna last Tuesday. So currently we're screening people that are symptomatic, which means you've got cough-like symptoms, or school teachers, or both. Both of those. But what we've found is that there was in times, and we've been able to support Cohuna Hospital to get all their staff swabbed, and another hospital down a bit further down in Gordon District Health. So what we do is we say what's needed, what have we got, and what we knew is we had a team of people that could come in fully prepared. We've got the swabs, we had the doctors ready to go with pathology and giving back results, and be able to safely swab people, and then people know where they're at. For some people, like with teachers and things, it's obvious that they need it for their role. But people that were feeling they weren't too sure if they were well or unwell could come in and get swabbed, and we have a triage. There's just people ringing community health from 9 till 12, and one of our staff will walk through the criteria with them. Great. And if they're deemed that they do need a swab, they'll book them in that day.
Yeah, fantastic.
So that's
what a response.
Oh, it's been huge. It's been amazing. The staff have been incredible. The community has been incredible, because we were hoping that we would be able to get a couple of hundred people through the swabbing clinic, and we got over 700.
Wow.
And that means for us, we've ended up with 8% of our population. Now, if you think of that in Bendigo or Melbourne terms, that's hundreds of thousands of people. So we are thrilled, and I know Daniel Andrews is saying he's thrilled, but we are personally thrilled, because we asked of our community to take the time to come out. And for people that had symptoms, it meant that they then had to self-isolate. So really we've said to people, come identify yourself as having these sorts of things, have a swab done, wait for the results to come back. So for people to do that meant that we have the data that says we've only had one positive in the whole of Gannawarra, long time back in time now, and with that we've had none since then. So really what we could been able to give data to be able to say we're in a pretty healthy spot.
That's right.
And with that with that sort of data, we've started to open up some of our services. But we're doing that very carefully, and I think people need to be really aware of that it's not that we're not just opening up the doors and doing business as usual. But we want people to know that when they come back in, that we're doing it in a very staged, safe way. We're really mindful of our who we work with, and often we work with the most vulnerable people in our community. Children, we work with people with chronic disease, we work with more elderly people, and everyone in between. But we're really mindful that people know when they come and they come to community health and they have a service, that they've been asked all the right questions, solve all the other people that they see in the waiting room, so they don't need to be as fearful that that there's a problem. But so that's why, and I'll take you for a bit of a tour.
Yes, we'll go for a tour in a second.
That's why we've kind of got it a bit. We've got it that it's
you've
a
got
bit
it all set up, so
people can sit far enough away from each other.
That's
Swabbing, cleaning chairs behind people, so people don't. We want people to feel as welcome as possible.
That's
so when someone hops up and wipes a chair down when they hop up, it's just because of COVID.
It's just something that we're all going to have to get used to.
We're very used to it.
It's just going to be a new way, and that may continue. For however long. It might even just become a normal part of our psyche. Is that we adopt these practices, which can't hurt to reduce other health.
No, that's true. It's probably a bit different it's been interesting for the clinicians, because we're used to stepping in. When someone asks a question, you step in so you can hear them, and you keep you don't want them to have to talk too loud, because you want them to be able to speak in a normal. So for the clinicians, it's been interesting really for them to take a big step back and have to do the 1.5 metres, but we all know it's for the health of everybody. And we try to make it as easy as we can for people that might need a bit of assistance coming in the door. That's always available. All those things that have always been community health won't go away.
That's so great. Well, I can't wait to have a look around the building.
Yes, come for a trip. I'm pleased to go.
Let's start in the big room, because I do want to. We want to advertise
This is what we
that.
call our activity room.
Let me turn it around. See if I can work my thing. Activity room. Look at this.
So we use this area for lots of different things. At the moment, it's set up for Zoom meetings.
Oh, fantastic!
Because what we've done is a lot of the staff, I would say at one stage we probably had only about 3 or 4 staff left in the whole organisation in an office, and everyone else was out on Zoom.
Yeah.
So with that, we use this area a lot for Zoom, but usually it's set up in more of a round table sort of situation. It's also used for some exercise classes on a Friday with Kay Wilson.
I've seen.
And so with that, there's lots of ways it can be used.
Let's have a peek in the kitchen.
Yep,
people can hire it out.
We
do
hire
catering.
it out so people can come and have do anything from art classes to exercise classes. Sometimes it's a meeting that needs to be held in a spot, and so of course they get the use of the kitchen facilities as well. But we just find, like anything, we find if you can have a meeting and offer someone a cup of tea,
yes,
or sometimes that people will have catering brought in. That's the way it works. We want people to be as comfortable as possible.
Coming in, and if they don't know that this is available,
well, this is right. So people are more than welcome to ring up and ask
and
about
come and have a look.
Use this area,
That's
and
right.
we really welcome people in for all different types of activities. So as I said, this is Kim.
Isn't she
Oh,
lovely?
she's so lovely. This is lovely. So Kim's here 4 days a week, and we have Nick here on a Monday. So you'll find all different people, but they're all got the great way of working with people.
That's right.
This is our
little waiting area. Oh, hang on, wait till I control my little thing. There we go. Bit of waiting area.
Waiting area with all of our bits and pieces that people can read and have a bit of a look at. But or put a suggestion in. We're always up for suggestions because
fantastic.
How we know we're doing a good job is because people tell us.
Yeah,
and
exactly.
If we're not doing a great job, we want to hear that as well. Fresh water, if anyone's walking past and would fill up a water bottle or sit down and have a bit of a drink, that's fine too. Through this one, this is our podiatry room.
Oh, I've never been in any of these rooms.
We have 2 full-time podiatrists.
Fantastic.
And they work out of here 4 days a week. Friday's probably the only day that they're not here, but so they work out of here, and we have people coming through all day. So the main thing that they are doing is working with people about getting them back to their ideal health. So it really is about how the person. So if someone says, I usually play tennis, and this is how my feet feel, then they might need to see a podiatrist. Or for another person, it might mean that they just want to be able to wear their comfortable shoes because that's what, So it's goal directed. It's what's important to
for that person.
So this is our podiatry room.
Wonderful.
To ring up and make an appointment. The other rooms are very similar in that they're consult rooms. So this one I'm working at, so this is a bit of what I'm doing my bits and pieces here. But these rooms can be used for anything from a counselling session to occupational therapy. The little table here, because we have a speech pathologist as well.
Lovely.
So with that, the speech pathologist, we have some programs that the speech pathologist and the dietitian do together. And so that means that they're little people chairs because we've got to have everything at the right height.
Everyone's welcome.
And enough room for families too, because often a little person will come with, always with parents of some sort of carers and sometimes some siblings. Then another room here, a bit bigger again, and these can be used for all different. The occupational therapists, as I said, will come through. Which
pretty versatile, aren't they? Like you can just.
Zoe, the occupational therapist, is coming in a moment, so she will probably see her float past and get
fantastic.
As well. In this room is we had a program this morning, so we do the drink, drug, drive program. So we do drink, drug, drive, and because usually it's held as a group setting in one of the big activity rooms.
Okay.
But because of COVID, we're now doing it at the moment over using Skype.
So what's that program for?
Drink, drug, drive. So it's people who have lost their licences due to driving infringements, and to get their licence back, they then do a program.
Fantastic.
And then, so it's all through Vic Roads.
Yeah. So you might have to go to Bendigo. If you guys didn't offer that sort of stuff, you'd have to go to Bendigo, Swan Hill.
Absolutely. So we have people come from Melbourne and further afield. So that's why.
Wow.
Because there's not that many drug drive programs around.
Okay.
So Leah Lacey runs that one for us, and it's a really busy program, and it's all around a behaviour change. So
fantastic.
She's run one this morning and done it all over Zoom, and as Mandy said, some people have loved Zoom and really have said, I haven't had to get on a bus with 25 other people
exactly.
at the moment, and haven't had to travel so far. And so Leah does that and answers questions, and she's found that it's been really engaging for the clients.
Absolutely. Some people don't want to come out. And if they can access it, then that's good.
And then we're down here.
Yeah. Mandy, pop quickly and say hi. Hello. There she is. That's just another one of the consult rooms.
Yeah, there's one of the consult rooms.
Oh, thank you. Very good. Well, it's good for people to be able to see.
So that's probably the Cook's Tour of
everyone.
Community Health here. Kareem's a slightly bigger site, and sorry.
That's all right. We're on the camera now. I'm trying to hold
you can tell I'm professional at this.
Oh gosh, I just make.
But I can see people are asking questions and we are so pleased with that.
Henty's watching, April's watching.
Oh, hello.
Chrissy
Oh,
Goldie.
isn't that
Yeah, you'll
lovely?
be
It's great
surprised
to
how many
see
people
people
watch. So
people are more than welcome to come in and ask questions.
Yes.
We've got staff here from 9 till 4, and their phones are always manned, and we're really keen for people to take advantage of that. We are homegrown as much,
Exactly.
and so we are. As we said, there's a lot of people that people will recognise. The community
Yes.
members will recognise the
maybe
staff.
not even realise that certain people work here.
You saying that you didn't realise how many people worked here,
Yes.
that's a really, really
Yeah.
a common thing that we
And I
get.
work across the road, and I see the comings and goings.
So we're pleased for people to come in, make it their space, understand what we do. Sometimes people will ring up and want to know a little bit about what we do for someone else, to give other people support.
That's
And
good.
in a confidential way, we're happy for people to get some information for others. So we really are often a starting place for someone's
Good to
journey
know.
forward.
Exactly,
Yeah.
That's right. Thank you very much
No
for
worries,
taking me
Amy.
through.
Oh,
There's
please.
probably so much more we could cover, but I do.
You're welcome to come back
welcome
another
to come
day.
in. Yes, and I looked at the website this morning, and I've accessed it in the past, and that's full of information as well. And it's probably important for people to know that whilst there's not doctors here, you do have a medical clinic in
We do have a medical
Kerrang that
clinic,
works
yeah.
side by side.
Also
so-
work very closely with the Oka Clinic here. So
Yeah.
what we do is so referrals will come through the doctor's clinic here. So it's about inclusiveness. So
Yes.
what we're looking at, what does the person want to achieve, and who are their support systems in their health. And it might be a doctor here, it could be a podiatrist in another area, and they might be seeing our dietitian around something. So we
Yeah.
work very collaboratively with other
Yeah.
organisations.
and all that, bring in all the allied health here.
We do,
Yes.
but we also have nursing.
As well
so
as
we have,
heaps of other stuff.
We do. Lots and lots of stuff. Look at our website.
How can we cover it in 20
No,
minutes?
just exactly right. More than happy for people to ask questions. More than
Yes.
happy for people to ring up and say, "I heard from Amy that you have," and
Yes.
how does that work?
We'd love that.
Absolutely, would love it. So
Yes.
engage with us at any level. Could be on our website. It could be on our webpage. It could
Yeah.
be some ringing up. We're up. For
And you've got
all
a
walking.
newsletter, an email newsletter that
Yep.
goes out monthly?
Once a month, yep.
Yeah, and I always get that, and it's fantastic to know what you're up to.
Oh, thank you.
And I've been watching out my office window from Stanton's and was slightly entertained on the swab clinic day when the nurses have been out the front in their full protective wear.
They did. They had
You
their
know.
full personal
Yes.
protective equipment on
Yes.
to make sure that our staff are well looked after. But also,
Yes.
we're really looking to our community to make sure that they're well looked
That's
after
right.
as well.
Take it very
we're-
seriously.
and our community are our staff that work here. So
Yes.
everyone's really interested in getting through this together and then getting back to our lives. It might be slightly different, but just getting back to what we know and what we really enjoy
Yeah.
about living in this space.
Absolutely.
Yeah, lovely.
That's wonderful. Thank you so much for
worries,
meeting
Amy.
with
It's been
me.
lovely.
And say thank you to Mandy.
will. I
and
will. She comes out of a
people, if you've got any questions, then just put them in the comments or send a direct message or give Kim or any of the other staff at Northern District Community Health a call. Oop, my thing's going weird. And thanks for watching along, guys. We always appreciate your support. And keep watching and keep following all our Cohuna Co stuff. Get onto Northern District Community Health Facebook page
Yep.
and email list and all that sort of stuff to keep up with the info from them. Appreciate your support, everyone. Bye.
See ya.